I wanted to quickly make this video because I just saw two children recently that had this serious issue. Our receding gum. No! This is when the gum and the bone no longer cover the tooth properly, a big problem. And I'm going to tell you why in a second and how to fix it. Before we get to that, in case you're new here, I'm Dr. J and I've been helping kids and parents like you for over 25 years. I'm passionate about fixing teeth because I know a beautiful, functional smile is so much more than looking good. It affects a person's entire life. I love helping people because it's directly tied to my faith in Jesus Christ. If you could do me a huge favor, hit that like button to support us for the YouTube algorithm and hit that subscribe button so you can stay up to date with all the new videos that we come out with to help you get that stellar smile. Here's what gum recession looks like and how it happens. Let's look at this diagram of a healthy tooth on the left and a tooth with recession and bone loss on the right. Notice the bone is brown on the bottom of the screen, and notice on the right side how it's a lot shorter. So what happens when the bone goes lower, it takes the gum with it. And when it does it, all of a sudden it's no longer covering the root. The root is the tan part. So what happens is when your roots are no longer covered by gum, they're super sensitive.
This is the worst.
Imagine how painful it can be when you have a glass of cold water and you have that zinger of pain. Why? Because of an exposed root. So if you see right here in this picture in the bottom of the screen, that root is completely exposed. The gum has lowered and it's no longer white. So that part of the tooth is yellow, and that's dentin. And dentin is super sensitive to cold, to sweets, and to other things as well. What causes localized recession? Genetics, bad bite, crowded teeth, the environment, poor oral health, lip and tongue piercings, I see that a lot, and of course aging. And habits, grinding, clenching your teeth, and also thumb sucking. So what are the dangers? Recession can lead to increased sensitivity and eventually tooth loss. I want to share with you a few examples of what this looks like. In example one, we have Colin. Colin's 7.5 years old, and if you see that tooth is sticking out just because the tooth on the top is pushing it out. So he has a bad bite in the front. But what that causes is for that tooth to lose the bone, lose the gum, and have recession. And that is just going to get worse with time. Now for my second example, Elena. Wow, this little girl is 6.5 years old and it's even worse. And it happens to be the same exact tooth. It's just luck, just chance. So what happens is the tooth on the top and the bad bite is pushing that tooth forward. And you can see from the front view how much that tooth is out. But also let's take a look at the side view. If the side view, you could really appreciate how much of a difference the gum line is with the tooth that's pushed out and the tooth that's next to it that's normal. Not only does Elena have recession, but also she has mobility. So that tooth is really rocking, it's really shaking. So she's in bad shape and this has to be fixed immediately. And here's my last example. This is an example of what happens if you wait too long. Taha is 15 years old. He has a beautiful smile. He has straight teeth, but he has severe recession on that tooth. He's going to have a gum graft. And a gum graft is surgery, and no surgery is fun. It's actually going to be quite painful. What they're going to do is they're going to take a piece of gum from the roof of his mouth and then cover that root and stitch it. No fun. Now, here's the good news. If your child's between the ages of 6 to 9 and has gum recession, this can quickly be fixed. Normally, it would take 12 to 18 months to correct with traditional braces and expanders, but with Invisalign First, it can be corrected in 6 to 7 months. Invisalign has been around for a while, but for children with a mix of adult and baby teeth, it's brand new. It's honestly a game changer. Here's a perfect example of how this is changing lives. Now, this is Tanisha. She's 7.5 years old, and notice that tooth. So it's been knocked by the front tooth, and it's pushing that tooth all the way out. The tooth is already starting to lose bone and starting to lose gum. We had to act fast, and we did Invisalign First, and we had incredible results. So this is a front view of the video simulation for Invisalign First, and this is how the teeth actually moved. And the number one problem in these cases is crowding. So yes, we're going to fix that tooth, but we also have to widen the upper and lower jaws. So look at it from the front. As you see, everything's coming together because everything is just wider, and all of a sudden the teeth have more space to straighten out. And here's a side view, and notice how the front teeth, because that's where the big problem is, they're starting to come together and they're able to fit together better. If you've seen my videos, you know that my all-time favorite view is the bird's eye view because it really gives you a panoramic view of what's going on, how crowded everything was, and also how narrow the upper and lower jaw are. Then we give them this nice U shape, which gives us plenty of bone, which allows the teeth to grow in the right way without having to grow on top of each other or be crowded. So only after 6 months of Invisalign first treatment, Tanisha's smile is completely changed and we saved that tooth. So notice how that tooth, the gum is already starting to grow. We've already regained some of that bone and probably even built some new bone. So just in 6 months, we saved that tooth and she is so super happy. And look at the before and look at the after pictures of her smiling. I put together a free comparison guide that breaks down exactly how Invisalign First stacks up against traditional methods. You can get that in the description of this video. Don't wait. Early treatment can mean the difference between a simple pain-free solution and years of complicated, costly treatments later on. There is no record of anyone in the scriptures whom God used who was not first tried. Pray. And remember, the greater the challenge, the greater the reward.